Are you one of the 10% of couples in the US that is struggling with infertility? Are you the female in the couple that would do anything to have a child? You feel like it's been your life's purpose to be a mom? Well, first I want to say I empathize with you. And secondly, I want to say today's video is dedicated entirely to causes of female infertility. We're going to dive deep today so that you can be empowered and have hope to dig deeper into your own specific case and find your own specific cause or causes to your infertility. In this video, we're going to assume that the male contribution to the fertilization process is okay, so we need to find out the female issue. But there are definitely issues that cause male infertility that may be the reason that you as a couple can't get pregnant. So make sure that you investigate those. I've done other videos on those, so check out my channel. But today's all about female infertility. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Now, like anything else that we suffer with as humans, the causes of female infertility are multiple, and oftentimes a female that is struggling with infertility has multiple contributing factors, not just one thing. So we want to dive into what are the multiple contributing factors that are at play and how many of them do you have, and these have to be determined by examination and laboratory work and diagnostics. So let's dive in. Now, this is not necessarily an all-inclusive list. This is a very inclusive list, but of course, like any video, we're not going to be able to cover every possible contribution. So let's start with a big one. A big one is autoimmune disease. So autoimmune disease may be driving your infertility. Well, there are many autoimmune diseases. So which one or ones are at play? Well, there's three big ones we want to talk about today. One is Hashimoto's thyroiditis, so autoimmune thyroid disease. One is Antiphospholipid Syndrome. So it's autoimmunity against the phospholipid bilayer of your cells. And the other is ovarian antibodies. So let's write that. Hashimoto's, ovarian, and antiphospholipid syndrome. So Hashimoto's autoimmune disease attacks the thyroid. Well, thyroid and progesterone, so thyroid hormones and progesterone hormones go hand in hand. So if progesterone levels are off, your thyroid could be off. But also if your thyroid is dysfunctional, then your progesterone can be off due to the fact that T3 drives progesterone production by luteal cells. And if you don't have progesterone, then you're not going to have a successful pregnancy. So Hashimoto's can drive it. Also, Hashimoto's has been found to be at play in repeated implantation failure. Repeated implantation failure are the people that the 10 to 15% of couples that have tried in vitro fertilization or IUI and have failed. Those people are classified as RIF, or repeated implantation failure. Oftentimes, Hashimoto's is at play in those cases. So you want to investigate thyroid autoimmunity. Ovarian antibodies are known to cause infertility because if your immune system is attacking your ovary, that's attacking your egg supply and attacking the storehouse for your opportunity to get fertile and have a baby. So there's obvious direct impact on the ovaries that can lead to infertility. Also, if it doesn't lead to infertility, it may lead to premature ovarian failure, meaning you may go through menopause sooner or faster or earlier. So I have a patient that has these antibodies that had premature ovarian failure, and she went through menopause at age 41, which is early. She also had infertility issues with her first child. So ovarian antibodies are something you want to investigate. On the male side, you can have testicular antibodies as well. Antiphospholipid syndrome, or antiphospholipid antibodies can be driven by multiple things, one of which is long-term birth control. So if you're on long-term birth control, that can drive antiphospholipid antibodies due to the estrogen in the birth control. Estrogen can ramp up or exacerbate autoimmunity. And so in that way, long-term birth control has been shown in the research to be a contributing factor to antiphospholipid syndrome, which is an autoimmune disease that can cause infertility. So that makes birth control pills and autoimmunity interrelated. And the birth control pills, like we said, can increase or exacerbate autoimmunity. And they also, as you know, or if you've read the label, they also increase clotting risk. So you want to be wary of that if you're on long-term birth control. Next, PCOS, or Polycystic Ovarian Syndrome. So PCOS is a sex hormone imbalance where testosterone levels are high or there's an androgen dominance. So PCOS could cause infertility due to the hormonal imbalance, and the driver oftentimes in PCOS is insulin resistance or poor insulin physiology. So you want to investigate your insulin physiology, insulin resistance, blood sugar issues, prediabetes or type 2 diabetes. All of these things are at play in PCOS. Next, we can look at stress. So stress in the HPA axis, or hypothalamic pituitary adrenal axis, can play a role in infertility. If you are stressed chronically, it's like you're chronically running from a tiger. And so when you're stressed, the body downregulates immune function and sex hormone production. So the reason for that is a white blood cell isn't going to save your life from a tiger, and reproducing while you're running from a tiger is not a high priority. So if you're under chronic stress due to any myriad of reasons, sleep deprivation, caloric restriction, overtraining, environmental toxins, et cetera, et cetera, et cetera, you have to get that under control because that may be a piece to your puzzle. Next. Single nucleotide polymorphisms, or SNPs for short. These are genetic variants that can play a role in your fertility. So at this point in time, probably everyone or most people have heard of the MTHFR SNP, or genetic variant. That is a gene that is required to methylate things in your body, or key to the methylation process, and a nutrient that is clutch for the MTHFR gene to function properly is folate, specifically methylfolate. And folate and other B vitamins are key for the development of the early fetus, specifically the notochord and the early central nervous system. So if there's any issues here, that can impact fetal development. But even before that, if there's any issues here, that impacts your ability to get pregnant, period, for multiple reasons. One is methylation, one is thyroid function. There's oxidative stress and inflammatory levels that play in. So your genetic makeup can contribute to your infertility. As we said earlier, thyroid function can lead to infertility if the thyroid is dysfunctional, because the thyroid produces T3, and T3 promotes progesterone production by the luteal cells, which are the cells in the ovaries that are producing the female contribution to conception. Toxins. Toxins can drive infertility. So endocrine disrupting chemicals like phthalates in your plastics, like parabens, like BPA, dioxins, Other environmental chemicals like glyphosate, which is used as an herbicide and pesticide, fluoride in our water, all these environmental toxins, heavy metals in vaccines and in other processes, all of these things can lead to infertility. So we want to investigate toxic load environmentally in our homes, in our water, in our everything we're doing. So we want to list, say, BPA, phthalates, herbicides, pesticides, fluoride, et cetera, et cetera. All of these things must be considered. And then lastly, for today, a huge one that we need to consider is infection. And this could be systemic infection, like you're just infected systemically and septic. It could also be a local infection. So I've made a video previously on how local infection could lead to infertility, and that video dives into urogenital infections and how a genital infection can reflux up into the uterus and lead to endometriosis due to an immune response to the infection. So that infection can damage or cause a toxic uterine environment, prevent implantation. It can damage the uterus and interrupt things that way mechanically. And I know we're not talking about men today, but an infection in the urogenital system will decrease sperm quality and motility, and so that may interrupt the male side of fertilization. So systemic or local. And so that can result in pelvic inflammatory disease, which costs $4 billion a year in the United States dealing with pelvic inflammatory disease. Infection of the uterus can lead to abortion or miscarriage. It can lead to preterm labor, and it can lead to straight up infertility. And as I mentioned a moment ago, it can also lead to endometriosis. So all four of those things, preterm labor, miscarriage, endometriosis, all wrap back around and can lead to infertility due to damage of the uterus. So that is, again, not an exhaustive list, but a pretty in-depth list, and probably more than you've heard in your searches and travels in the conventional medical world. So remember, everything is connected to everything. From a functional medicine perspective, if a person or a couple is struggling with infertility, we need to do more than just look at progesterone and estrogen. Those things may be completely fine. It may be an autoimmune process. It may be toxins in your environment. It may be a chronic subacute infection. It may be insulin resistance. It may be a thyroid disorder. It may be long-term birth control. So there's many, many things that must be considered in the female contribution to infertility if you hope to become fertile and pregnant and have that successful birth that you want so badly. So if you've exhausted all conventional means and you're willing to look from a functional medicine perspective into your case and figure your puzzle out, I'm Dr. John Bartemus, and I would love to assist you and partner with you in that. Or if not me, then find a functional practitioner that has knowledge in these areas and can be your CSI health detective.